Let's start again. Good morning, welcome and thank you for attending the meeting for our Adult Health and Social Care Policy Committee. The meeting today is open to the public. The meeting will be webcast and the recording will also be available for people to view later through the Council's website. It is also possible that Sheffield Live TV will be recording and rebroadcast the meeting. We have not received any public questions or petitions from members of the public by the submission deadline, so we have none of those. And please, can I request that mobile telephones and other such equipments are switched off or put onto silent mode as to not to disturb the conduct of the meeting. There is no fire test planned for today or this morning. If there is an emergency evacuation, please take instructions from the Town Hall staff and the assembly point is Tudor Square. I will ask with asking members to introduce themselves and then I will go on to officers here at the top. I'll start on my left.
Martin Phipps for City Ward.
Abdisan Mohammed, Councillor for Firth Park Ward.
Ruth Milsom, Councillor in Crooks and Crosspool Ward and Labour Group spokesperson for this committee.
Hello, I'm Councillor Mick Rooney, and for once I've actually managed to get this working first time around. Can I have a round of applause, please? It'd be really nice. Thank you.
Follow that. Steve Ayres, Councillor for Graves Park Ward.
Councillor Sophie Thornton for Beechiff and Greenhill, Deputy Chair of the Policy Committee.
Councillor Gail Smith, I represent the Mosborough Ward.
And the officers, I'll start on this side.
St Mark's Chapel, I'm Strategic Director for Adults Care and Wellbeing.
Sarah Bennett, Assistant Director, Legal Services.
Fiona Martinez, Principal Democratic Services Officer.
And also Alan, who's helping us with all the tech. Okay, so apologies for absence. Do we have any?
We don't know.
Exclusion of press and public, there are no items that require exclusion of press and public. Any declaration of interests from members? Brilliant. And sorry, let me just go on the second page. Minutes from the previous meeting. These are on page 11 of your pack if you have a printed copy. So I will go through them for accuracy. So page 11, 12, 13, 14, 15, 16, 17, 18. I just have are there any matters arising? I just have a tiny little question myself. On page 13 for item 8.2, is there a timeline for 8.2 number 2, request that a report on outcomes and impact of the recommissioning exercises brought to the committee? Do we have a timing? Could we just clarify that? Just so that we don't miss it out when it needs to come back to committee. Thank you. So item 5, public questions. We said that we haven't received any. And item 6 is just noting that on the 1st of September 2023, Councillor Malachi Habe has been appointed as substitutes on the Health Scrutiny Subcommittee. Are members happy to know that? Brilliant. And item 7 is members' questions. This is a new item that all committee have where members of the actual committee can put questions to the chair. We haven't received none this time, but it's an item that we will have as a recurring item as item 7 every time. So Item 8 is the work programme.
Hi, good morning. So there have been a considerable number of changes to the work programme since our last meeting in June. And as you can see, Appendix 1 lays all of those out for you, along with some of the items that have been moved from one committee to another. As always, this is your opportunity really to let us know if there are any items that you'd like us to add to the committee programme, and if you've got any comments or clarifications on anything that's already on there.
Are people happy to approve the work programme? Can I just mention there has been 2 items added to today's agenda, and my comment would be, and it's something that I'm discussing already with officers, that it's just the length of the papers that we're getting, and we will discuss this afternoon. So when other items are added, we just need to keep that in mind of how we distribute them around. But the work programme is like a, it's changeable. It's not set in stone anyway, because we may require or request that other items are added to the work programme at any time. Okay, brilliant. So item 9 is adult working with people with people delivery plan. It's on page 49 of your pack, and Janet Carey is going to present this for us. Thank you.
Morning, everyone. My name's Janet Kerr. I'm Operations Director in Adult Care and Wellbeing. The Working with People delivery plan isn't something new. It's not something that you won't have heard of before, but working with people is the first theme in the CQC assurance, and basically everything that sits within that sits within my responsibility as Operations Director. So what we've done here is laid out the things that are included in that, the things that the CQC will look at when they come and visit us, just to get that out there so everyone knows exactly what that needs to cover. I don't think I need to take a lot of time talking you through this, because most of it you'll be very familiar with. But the important thing to say is we'd like you to endorse this Working with People delivery plan, and to say that we'll be providing 6-monthly updates on our progress with the things in it. And just to give a brief summary, the things are our reviews, our performance with reviews, our weights, both social work and OT weights, how we deal with carers, the sort of thing that is our bread and butter and business as usual. And actually, I guess that if you were building a wall, this is the first layer of bricks. So this is important, we think, to have out there and be clear, and to be very clear about how we're progressing on the things that are included in that. So I don't think I've got anything further to say unless you've got any questions for me.
Are there any questions on this one? Brilliant. Thank you. So we are asked to endorse the Working with People delivery plan and request that the Strategic Director of Care and Wellbeing provides the committee with updates on the progress against the delivery plan on a 6-monthly basis, including updates made based on ongoing learning. We're all happy with that. Brilliant. We're on fire today. Item 10, recommissioning of a number of services providing short-term housing-related support to vulnerable adults. Sam, good morning.
Good morning, folks. I'm Sam Martin. I'm Head of Commissioning for Vulnerable People and Community Services in the Integrated Commissioning and Public Health Service, which is a longer mouthful every time I say it. So this paper that you've got today is seeking approval to recommission a number of services that fall broadly within the scope of our cluster of services around housing-related support. Some of the services are accommodation-based services where someone gets either a flat or some form of accommodation alongside support, and a couple of the other ones are what we might call floating support. So people who've got their own home, their own tenancy, and the support then goes out to that home to help them maintain that where there might be a risk of them losing their independence. Just by way of the the committee processes, these are all individual service contracts, but because they all expire in the next 6 to 9 months, they would all need to be recommissioned. So partly to streamline the process for committees and reduce the number of separate agenda items, we've decided this year to try and pull those into one report so that we can bring it for one approval, which seems like a sensible way of doing things in terms of papers and agreements. So all of the services expire at slightly different times throughout this year, but really what we're seeking is the approval to go out and recommission them. The paper sets out which those services are, but essentially they're a rough sleeper outreach service. It's one of our services that provides accommodation and support to people who have a history of offending behaviour, so find it quite hard to get other tenancies. There is a service which is for people who are coming out of detox and rehab, so they can live in a drug and alcohol-free environment for a period of time while they maintain their independence and move on to hopefully an independent tenancy after that. And there's a service which provides floating support for people who are over the age of 55 who may be at risk of losing a tenancy, partly because their health might be deteriorating or for other reasons. So these are all services which were part of our housing support review, which came to committee earlier in the year. And the outcomes that we get from those services are generally quite good. They provide a really beneficial service to people, which prevents them needing higher cost care often, and helps us provide our homelessness duty as a council as well, because most of the people in these, particularly in accommodation schemes, would otherwise be owed a homeless duty and end up in something like B&B or a hotel where they don't get support, and also the council loses benefits, subsidy loss as well through that sort of thing. So, and there's some examples in the paper, I think, of residents in the complex needs service, which is in here, who previously had spent some time in residential care, at cost of £500 to £1,000 a week, and now they're living with the high support service that we've got and doing very well in terms of outcomes and progression towards independent living. The paper also sets out the consultation that we've done both with service users and people who have used those services in the past. And we've made a special effort, the team made a special effort this year to reach out to particularly women and to people from minority ethnic backgrounds who are, there are different representation in some of the client groups. So we've made an effort to try and get to some of those groups in terms of our consultation to find out what their particular views and thoughts might be about how those services might change when we recommission them. So I'll pause there and happy to take questions, Chair.
Councillor Rooney.
Thank you, Chair. My question's about how do we, given that these are very, very vulnerable people, and how do we, or what is the process for making sure that they are getting the quality of service that we think they are getting? How do we check on the provider of that service? What's the process, and who is it reported to? The reason I ask that is because it's locally I get 1 or 2 complaints about people who should be being supported, seemingly, at least at first sight, not getting the support that they're supposed to, and causing a few problems in the local neighbourhood as a result. So I'm just asking, how do we check that those people are getting what they deserve and what we're paying for?
Yeah, so all of the contracts, I think the service you might be talking about there, Councillor Rooney, isn't one of these ones that's up for renewal, but it is in the general scope of the services that we commission through this budget. So all of the services have a quarterly contract review process, so where the commissioning team will go out and go through both the contract outcomes, they look at the data that we've got on the housing pathway system, so all the services input their data onto a system the council owns, so we can look at individual outcomes for people, and we can also aggregate management data so that we can see generally which services are doing better than others. Where we have any concerns, we've got a process where we might escalate those concerns. Obviously, there'll be an action plan initially for the provider to come up with and respond to and deliver. If that doesn't work, then obviously we go through a usual sort of contractual process where a provider isn't doing what we think they should be doing or what they've agreed they'll do. We also the team do a lot of responding along with colleagues, both from social care or from housing and from member queries where there might be individual issues around either a particular property or a particular resident. And they do quite a lot of work to try and resolve some of those issues. And I know they've done work with various council members in different parts of the city where there's been concern about a particular resident, how they ended up in this property, and done quite a lot of mediation. And where it's necessary, people have providers have tried to move people. What we try and do is encourage people not to go straight to evictions, because obviously you've got a client group that is quite hard to support, and if they just keep getting evicted, all you end up with is a cycle of people moving to different properties around the city and not getting the help they need and moving on. So we do try and work as hard as we can to resolve any problems that you get locally, but it's not always easy. But I think what I would say is if you do have concerns about a provider that we're commissioning, or even if you don't know, you can always check with us. If you feed that through to me or to the team, we can see what we can do about it.
Any other questions? I actually have one myself. Obviously, I understand why the numbers are estimated. And whilst the body of the report shows us the estimated annual cost and the total, can I suggest that in the recommendation where we say estimated value of, can we add the word total, as in for the whole life of the contract, because it's not clear there whether it's the annual cost or the total cost of the contract. I know that the number is not set in stone because obviously prices will go up, it's 5 years contract, etc. But could we have that added in, Sarah, in terms of the recommendation? So, for example, the first one is the recommissioning of...
So each one would be estimated total value?
Yeah, or for the life of the contract or something, because there is another one later on, another report where the cost in the recommendation is the annual cost rather than the total. So it's just to make sure that we are clear in the recommendations whether the money that, the number that we have is for the life of the contract or if it's the annual cost. I mean, it does say so in the report, but I think it would be good to clarify that in the recommendations. Are members happy with changing that so that it's crystal clear that it's not an annual cost of, but it's like an estimated cost for the life of the contract?
To avoid that being a proposal and seconded and voted on, can I suggest that Sam, as the author of the report, says that he would prefer it if you took it as estimated total value in each of those recommendations and that you vote on it on that basis?
Okay, I'm happy with
I have to say that, or can I just say what Sarah said?
Yes.
Yeah.
Brilliant. So it's a really kind of long list of recommendations because the 6, I really like this format. I think it works in terms of how, because we've had individual briefings on all of these anyway. So the recommendations are as follow. The recommissioning of the street outreach service from an external provider for a period of 5 years and an estimated value of £1,115 as set out in this report. The recommission of an accommodation and support service for people with history of offending from an external provider for a period of 5 years and an estimated value of £2,008,220 as set out in this report. The commissioning of an abstinence-based accommodation and support service for an external provider for a period of 5 years and an estimated value of £915,000 set out in this report. The recommissioning of a drug and alcohol prevention and recovery support service for people living in the community from an external provider for a period of 5 years and an estimated value of £1,729,065 set out in this report, and recommission of 18 units of the Thrive Complex Needs Accommodation and Support Service from an external provider for a period of 26 months and an estimated value of £418,412 as set out in this report. And finally, number 6, the commissioning of a service that helps older people, 55 plus, who have deteriorating health and to access relevant support so they can continue to live independently for a period of 12 months and an estimated value of £794,233 is set out in this report. Are we happy with those? This is really challenging for my eyesight. I'm just like, but thank you. No, it's okay. Brilliant. We got them all through. Thank you so much for the report. And we are on to item 11. Community Infection and Prevention Control Services. And I think Ruth is presenting. Thank you, Ruth.
Good morning, everyone. So I'm Ruth Granger. I'm a consultant in public health in the public health team here in the council, and I'm here to talk about community infection prevention and control and to ask for a decision to increase the capacity for infection prevention and control by agreeing to funding from the public health grant to increase the capacity that we've got in the city to support providers with this fundamental aspect of quality care provision. You'll have seen the paper, and the recommendations are based on a lot of the learning we had from COVID about parts of community provision where infection prevention and control could be better and good practice could be followed better, and our learning from audit from outside agencies suggesting that in Sheffield we had low levels of capacity to support our providers with good infection prevention and control. Infection prevention and control is quite a lot of quite basic and fundamental issues such as hand washing and good disposal of waste and appropriate wearing of PPE, but it is that some providers do struggle to do that and follow good practice in that way. So we want to increase the provision that we have in the city to support providers with that. Currently we have provision which is based within the Integrated Care Board to support care homes and GP practices, but we would want to use this increased provision to also provide support for domiciliary care providers, supported living, extra care housing, and early years, special schools and housing for vulnerable people. So it's quite a range of different settings where we feel that they could benefit with support for good practice. I'm happy to take any questions on the proposal or on what sort of provision we think would be appropriate for those settings, which I've outlined in the paper, but I'm happy just to leave it there and take any questions, if that's okay.
Any questions? Wellbeing.
Thank you, Chair. Thank you. Just a really basic question, really. What kind of measures do you think people will actually see in the settings? So how will this materialise in the first instance?
Well, I think one of the things that we really found during COVID, and a lot of this is learning from COVID, is that the guidance that was available for different settings wasn't necessarily very appropriate. So people would be trying to follow guidance on how to keep people safe in a hospital ward when they were in their own homes. And some of that is about things like, where do you dispose of your gloves appropriately? Do you put them in the kitchen bin? Do you put them in a bag and take them away? It's some of those really basic practical things where services need support to take that guidance, which hasn't been written for their setting actually, it's been written for a hospital setting, and to say, well, how will I put this in place when I'm going to see the person I go and see at 10 o'clock on a Wednesday morning, and I wear some gloves and then I take them off and I need to dispose of them appropriately. So I think in terms of what patients or clients or users of services will see would be about an improvement to the basic levels of understanding of doing good infection prevention and control in their setting. One of the things that we would really want this team to be doing is having each member of the team to have a specialism so that they could develop a level of expertise about that setting and about what works appropriately in that setting. So, for example, you'll have seen that we think that early years needs some more support, and that's because we all know children under 5 aren't very good at washing their hands. They're maybe not very good at blowing their noses properly. You need a particular range of approaches you're going to take with 2-year-olds, which are different from approaches that you would take in, for example, a hospital ward. And we would want this service to be able to update and use guidance in an appropriate way for the setting that they're working with. Does that answer your question?
So we're talking about things like bins and good practice and
Yeah,
signage that educates people.
Yeah, and we're also talking about things that staff who work in settings can do. So are they using the appropriate cleaning materials? Are they, for example, on change mats, are they washing them appropriately? Are they putting in some things that would make it quite easy for them to do that in a safe and clean way? There's also a sort of wider range of things which prevent infections such as vaccination. So there would be a role for them in terms of supporting making sure that staff are aware of appropriate vaccinations that they should be having in order to protect people that they're working with.
Thank you. Councillor Rooney.
Yeah, you mentioned the two words that I was thinking of, children and vaccinations. And how are we dealing with the decrease in the number of children that are vaccinated against measles, for example? It is a real problem. I'm just wondering how you deal with that, because really that's down to the parents, isn't it?
Yeah, and
To do the right thing for the children, not only their children, but the other children that their children come into contact with. So I'm just wondering what approach we're taking with that. And the other one is something I'm not entirely sure about, but we used to have a clinical waste collection service, I believe, from households that was, you put it out for a certain time in the morning, and then I think VLD would come and take it away, but I think that's been stopped. I think. I'm not entirely sure that I'm right about that.
Yeah,
It's for example, someone who has dressings on ulcers on the legs and that sort of thing. I think that's been stopped.
Yeah, I don't know. I don't have the detail about that, I'm afraid, because that's a part of
I'm
the waste colleagues would do. But I think some colleagues over there seem to.
I'm not sure of my footing on that. I'll be honest with you.
Because the black bin rubbish is burnt, so people are just advised to bag it. So if it's, if you've got a dressing, like the nurses come and they do a dressing, they'll put it in their own bag and put it in your black bin. And because it's got burnt, it doesn't need to be separately picked up anymore.
And I'm happy to answer the question in relation to measles. Yeah, I agree. We are concerned about not all communities have got high enough levels of vaccination uptake as we would like to see. We work really closely with our NHS colleagues and partners who deliver vaccination to sort of seek all ways to support people to make it as easy as possible for them to have their vaccinations. One of the roles that we can play as a local authority is in relation to encouraging people for their children to be ready for school, and saying part of being ready for school is being up to date with your vaccinations. That's a message that we can really legitimately give about being ready for school. But we also work with our NHS colleagues about how they both make it easy and communicate on vaccination. I think it's worth saying, and we learned a lot about this again during COVID as well, that it's actually a very small group of people who say, no, I definitely do not want my child vaccinated. There's a group of people who have got genuine questions that they need asking, and also need it to be as easy as possible for them to get their vaccination. So that's a subject that often we talk about at the Health Protection Committee, but I'm really happy to provide more information on that afterwards if you'd like me to.
There's a reverse to what you just said, that they don't want their children vaccinated, but I think that the parents of the other children that might come into contact with them have got a right to say, I don't want my child coming into contact with a child that hasn't been vaccinated. And I'm just wondering, might get me undrawn and quoted this, but would it be possible for someone who's running a nursery or an early years setting to say, unless you can prove that your child has been vaccinated with all the necessary vaccinations, that they can't come in?
Well, there's quite a lot of legal aspects about this, in the sense of vaccination isn't compulsory in this country, and we'd always rather people chose to vaccinate their children. So, there's some quite difficult issues there that nurseries have to deal with, and one of the things that this service and the part of this service that we're working with early years would be talking to them about not just the cleanliness of their nursery, but how they work with families to get vaccination as good as it can be to protect all the children. Yeah.
Yeah, the point I'm trying to make is, could a business
Councillor
say,
Rooney, I think we're moving on now. Sorry, I've got two more other people, and I think it's kind of it's out of the kind of scope of this particular report. But we can ask those questions to Public Health, can't we?
Yeah, absolutely.
And get some feedback on that. I've got Councillor Phipps and then Councillor Mohammed.
Thanks, Chair. It's just a quick question. I was just reading the report and wondering about kind of the cost share aspects, because sometimes like NHS and SEC will split costs depending on if it benefits both organisations. And I see there's a responsibility for both organisations on this in the report. I was just wondering, it probably is the case, just want to check, are the existing two infection prevention and control nurses funded by the ICB then?
They're joint funded by the Public Health Grant and the ICB, so there's currently a joint funding arrangement. Yeah.
Okay, thank you.
Councillor Mohammed?
Thank you. It's just following on from Councillor Phipps's question. Is there a reason why this can't be joint funded with the ICB as well going forward and not fully funded by Public Health?
We did try that approach first, and that wasn't successful in getting it joint funded. Part of the reason why we have decided to seek a decision to have it funded by the Public Health Grant is because of the risks that it presents and because of the responsibilities of Greg Fellows, Director of Public Health, to be assured that there are sufficient systems in place. So we didn't want to continue with a position where we were not having success at pursuing joint funding and that therefore there wasn't sufficient capacity. So we did decide that we would seek to have it funded by Public Health Grant in order to get a service in place.
Thank you. Do we know what the reason was as to why the ICB are not joint funding?
Well, we went to the Better Care Fund joint commissioning meeting for a decision about that, and while there was a recognition of the risks, there wasn't a decision to joint fund that at that stage. So we made a decision that we did need to have something in place, and therefore we should seek to have it wholly funded by the Public Health Grant.
Thank you. I think it's a matter that we probably need to take up as a committee.
I agree.
We have concerns in how the ICB are making decisions which don't filter within the needs of what Sheffield.
Thank you. Yeah, I was thinking exactly the same. I will seek clarifications about that. Nevertheless, I think this is about not having it or having it. And I think I can see, the kind of your point. I see your point, but I think it's not a.
I agree. I don't think it's a decision it shouldn't influence the decision that we make today. I think it's a separate discussion about how the ICB are making decisions about joint funding. Okay. That was one of my questions. The second one relates to community organisations. Yeah. There doesn't seem to be anything in here in terms of how we control and support infections or organisations to manage infections. And I think when COVID happened, many community organisations were left out in the lurch to manage and support how they would manage COVID at that time themselves. So how would they fit into this model?
Yeah, so I think there's sort of two answers to that. Often we've got community organisations who are delivering some of the services that we're talking about. So often, for example, early years provision can be provided by a voluntary or community sector organisation. Where that's the case, obviously they would be supported. If elected members felt that they would like us to broaden the scope to support voluntary sector organisations that deliver other services, we could consider that. I think that a lot of services that would be delivered by voluntary sector organisations would be covered under the headings that we're talking about in terms of delivering care, but it might be, Councillor, that you're meaning sort of broader services. Are you thinking of things that are beyond sort of delivery of early years, delivery of domiciliary care?
I am. So there are a number of organisations that provide services within the community that sort of are preventative services for people, older groups, vulnerable groups, ethnic minority groups, and they provide commission services in terms of support for those particular groups. And I don't think they would fit in these categories that are here.
The other thing which we can do, which I think would be helpful and constructive, is that during COVID, when we did have additional capacity and infection prevention control nurses, for example, provided training and guidance, that was available to a broad range of services, because actually to have 20 people on a Zoom call is no different from having 50 people on a Zoom call for training, for example. So I'll make a note of that and update our specifications so that the training would be more of an open offer for the training, because I think that is a basic level of infection prevention and control which would be really helpful to a wider range of services than I've got listed in there. So I'm happy to update that in that way.
Councillor Thornton, and then we'll move on.
Yeah, thank you. I just have a quick question, really, in that, well, more of a ask, in that as we go into different types of organisations, can we get feedback at some point on the benefits of this and how this is tangibly working? Obviously,
absolutely.
As we go into different domiciliary care, etc., you can probably get a rate of infection that they currently have through risk registers, I'm assuming, through different services. It'd be nice to see how this is working over time, and could the committee get an update at a later stage on that, really?
Yeah, one of the things to say about that, which has been really successful as a tool for improving practices in care homes, they've been doing an audit process where they go along with some standard things that they're looking at. The care home are encouraged to have a look and assess themselves against the audit tool, and then take advice about how they could improve. I think that a similar sort of process of audit could be applied to quite a range of different settings, and then you could show the level of improvement you've got. And also that's really helpful for a setting, because then they can see where they are, where they need to get to, and then they can have some advice on how they can improve. So our intention with this would be to employ a similar audit mechanism with different settings to be able to show where you've had improvement, and also for settings to know where they are at that point in time.
Yeah, thank you. I think that would also probably be helpful going forward for to show the ICB that money is well spent in a way as well, going forward with those kind of funding arrangements. But yeah, thank you. That's very helpful.
Great, thanks.
Great. Before I ask people to agree or disagree on the recommendation, Sarah's got a reply regarding toxic waste with the official line.
Thank you, Chair. I have managed to speak to waste colleagues, and as it's slightly different to what we discussed, I felt it was appropriate we should correct the public record. So there is still a weekly service offered for both infections and what he refers to as offensive waste. Both have to be on referral from a district nurse. However, in addition, you can put offensive waste in the black bin, and you can get additional black bin capacity if needed because of that. So it's not that what was said was wrong. That is true. The waste is incinerated, so it's safe to put offensive waste in. But if a district nurse feels that you should be referred for a weekly infectious and offensive waste collection, then you can be. So that service does just still exist.
Thanks, Sarah. I thought it was important for clarification on that, because I was aware that that was still available. We are now going to look at the recommendation, which is to approve the allocation of 250,000 maximum per year for 3 years, with an overall allocation of £750,000 from the Public Health Grant Reserve for the purpose of increasing capacity for infection prevention and control, and agreed to commission and a community infection prevention and control service as set out in this report. Can I suggest that we minute that I am going to seek clarification from the ICB on why they're not, and that it can be a matter arising for next meeting? So we have, yes, Councillor Milson.
Just on that, Chair, I think it might be, I'm just thinking it might be useful to treat that through health scrutiny as well, as we can scrutinise that at place level, so we can actually come at that from both angles. So just a minute that we will look at that in scrutiny as well.
Perhaps to support, as members know, there's been recently a joint health and care finance group set up. It's going to be co-chaired by myself and colleagues from the ICB, in which we're going to look at funding jointly together, and that would I think be a way of starting to look at some of the issues around the joint funding that was described today. And what I can do is put that as the first on the agenda and then provide feedback to members to particularly support the position that members have been raising today around the joint funding, if that's helpful. So in the minutes from that meeting will also come to members through the briefing meetings as well. It's as an additional layer of governance and support for members.
I think we can do both. That would be very useful, thank you. But also scrutiny, I think it's a really good point. So are members happy to approve the recommendation for this report? Brilliant.
Great.
We are now on to item 12, which is Sheffield Physical Health Strategy for people living with severe mental illness, people with learning disability and autistic people.
Good morning, everyone. I'm Heather Burns. I'm Deputy Director within the Mental Health, Learning Disability, Autism and Dementia team at Sheffield Place Integrated Care Board. Liz?
Hi everyone, I'm Liz too, also working in the same team, Head of Commissioning.
And we're here to just talk to you this morning about the physical health strategy. This is a strategy that's been in place for a number of years. Sorry. Oh, sorry.
Is that working for me? I can share. That's what we do. See, I'm fucked by the technology as well.
Apologies. So the physical health strategy has been a piece of work that's been in place for a number of years, and it's particularly regarding the needs of people with learning disability, learning disability, dementia and mental illness. And the reason we need to do that is because these populations do die of preventable health conditions up to 25 years earlier than the rest of the population. So we're talking to you about this strategy, which has been refreshed, and I'm going to hand over to Liz Tuck because she's done an amazing amount of work on this over the last 3 years.
Oh, thanks, Heather. I mean, to be fair, this has been a partnership piece of work. So it's a strategy that's been running since 2019 across NHS, local authority and voluntary sector organisations. And as Heather said, we've come to you because we're refreshing that strategy. We want to refresh and renew it from 2023 to 2028. We've been through an engagement process, both with partners and other organisations working on the strategy and with people with lived experience and their carers. And actually, we're not looking at making massive changes to the strategy, but we do want to make sure that we're taking on board feedback from everybody to make sure that going forward we are renewing and refreshing it. The overall ambitions for the strategy are similar to the previous version. It's around making sure that people with severe mental illness, learning disabilities and autistic people have equitable access to healthy living and wellbeing activities in their community. And that can contribute towards the promotion of wellness, prevention of illness, earliest intervention, recovery and living well. The second ambition is around making sure that people have equitable access to physical health care and interventions that they need. So that includes GP, hospital, national screening programmes, dental care, vaccinations and things like that. And thirdly, that for people who are receiving health and social care services or services that are particularly related to their mental illness, learning disabilities and autism, that as part of that care, that physical health care is recognised very clearly as well. So we'd like to ask that the committee endorses the strategy, particularly recognising that one of the key changes that we've made with the strategy is that it will become an all-age strategy. The previous version did focus primarily on adults, but we recognise both from feedback from people with lived experience and from other partners that it's the right time now to move this into being an all-age strategy. We also will have an increased focus on ensuring that the organisations within the partnerships as well have got really clear plans within their organisations for how they're going to be meeting the needs of these groups of people. And recognising that actually these are three groups of people that have lots of differences about those groups of people, but unfortunately, as Heather had said, in terms of health inequalities, there are some very, some quite sad and shocking similarities really that we want to address.
We'd also like to request that we come back for annual updates on the implementation of the strategy as well. There's an annual delivery plan, and we're keen to update you on that, particularly focusing as well on how we are going to continue to meet the improve how we meet the needs of people with across the different ranges of protected characteristics as well, which is another area that we've recognised is more that we can do on. So happy to take any questions if there's anything that members would like to ask. Thank you.
Councillor Rooney.
Yeah, again, I'm assuming that this strategy and the needs of these sections of society have been written into the procurement process that we're going through at the moment for the new leisure facilities. I would have thought that that would be an obvious place to make a start.
Is that all right if I just come in on that? So it's a good question. Now, one of the, as part of the cabinet member briefings that I did go to the communities member briefing, and we did talk about the leisure strategy. It's, to be honest, it's an area that we want to develop further, so it was an area that was invited to have some further discussions. So I'm not aware that of the detail of it at this moment, but it was an action that we took in terms of the delivery plan. Certainly the strategy itself does cover, as I said, around healthy living and wellbeing activities, so I think it is very much within the scope of this strategy to look at that, but the detail of it is an action that we have identified, but we've not looked at in detail. There may be there are others who are more involved in terms of the actual procurement side of it who would be able to comment more on that though.
The reason I've raised it is because we've got a blank sheet at the moment, almost, and I would have thought if there's any inadequacies in our provision for this section of society, now would be the time to put it right.
We'll follow that up with Councillor Rooney in terms of who's leading on that procurement. We'd be really happy to work with them. Thank you for that suggestion.
Thank you.
Yes. Thank you. Just quickly, I suppose it was something that was raised with me outside of council settings, where a one-to-one supporter she's always wanting to take the person that she supports to different leisure facilities, and raised it with me that often for example, like costings and prices and there's differences of service across the board. So I said that I'd followed that up and spoke to Councillor Williams, who chairs the Parks Committee, and he said that he would look into that for me, particularly with this ongoing procurement that's going on at the minute. I can ask him to keep you in the loop on that if you'd like, Councillor Rooney.
Thank you. I think it's a good time to make that connection because things are still being written, and once the procurement, the contracts are stipulated, it's harder to change things. So I think it's really important to use the time that we have. But thank you.
We'll follow that up. Thank you for that suggestion. Thank you.
That's great. Thank you so much. So, are members happy to approve the recommendations, which is approve and adopt the jointly developed and refreshed Sheffield physical health strategy for people living with severe mental illness, people with learning disabilities and autistic people, and request that the strategic director, adult care and wellbeing, provide annual updates as to implementation of the strategy to the committee.
Agreed.
Brilliant. Thank you. So item 13, which is advocacy services, current and future. And I believe that Avi is presenting on this. Thank you, Avi.
Morning everyone, thanks for your time. Some of you may remember that I came in March to talk about an extension to current advocacy services, and this is a follow-up from that really. It's looking at the commissioning of advocacy services from April onwards. At a value of, I just want to highlight, because there might be some confusion around this, the figure highlighted is 1.23 million per annum. So we're looking for a period of 7 years. That is subject to annual uplifts that will come to committee separately. So the advocacy services at the moment cover mainly statutory services, but they also cover non-statutory learning disability advocacy. We went out and did a robust piece of engagement. We spoke to special educational needs colleges, we went into an older people's care home, we went to an LD drama group and a number of other areas to talk to people who use services. And we also spoke to the different professionals, and from that we've come to a new specification that we're looking to introduce, that will look at not changing a lot of the subject matter of advocacy, although we are looking at increasing it slightly, but also looking at the service delivery and raising awareness throughout the city and the training offer for professionals. So we're looking to, well, the request here is, the recommendation is to agree a long-term advocacy commission for a period of 7 years.
Any questions? Councillor Mohammed?
Just a quick question. So is this, are you looking to commission one provider or a number of different providers? And based on the sorry, it's two questions. And based on the consultation that you've done, what's going to change from the previous commission that was there? Thank you.
Definitely. We're not sure who will be successful in this. So at the moment, it's run by a hub. So Citizens Advice Bureau are the lead organisation, but Disabilities, Sheffield and Cloverleaf are part of this hub. We're not sure who will be successful in the future, although we recognise that all the organisations have a lot of strengths and specialisms. In terms of what will change, we're looking at things like digital enablement to increase awareness. We're looking at additional training for professionals and extending it beyond health and social care. So looking at education, for instance, and then being aware of advocacy and aware how to refer into advocacy. In terms of the areas of advocacy, we're looking at non-statutory deaf advocacy, and we're in discussions with Children's around parental advocacy for parents of young people who are subject to child protection proceedings. But also we've actually written, we're intending to write this in a way that we can cooperate with the ICB and other organisations in the future. So just to give you an example, at the moment SEDACA have a BAME advocacy contract, but that is lottery funded. But if in the future that will end, but there'll still be a need for that, we'll be able to incorporate this within the contract and draw on the funding from the appropriate location. So we're trying to future-proof this specification so we can look at different areas in the future as well as we need.
Any other questions?
Thank you. I was reading in the report about the engagement work you did with sort of current advocacy hub staff and about sort of comments about workload and waiting lists and the pressure to sort of get through cases. And I just wondered if you felt like what is being proposed over the next 7 years will sort of deal with some of that, both from a workload perspective for staff members, but also in terms of meeting the needs of those who need to use the service for advocacy.
Yes, so what we've done in the previous commission, it was the first time we commissioned advocacy services in the city, so we really didn't have a lot of reliable referral data to go on to be able to forecast. Now we've got about 7 years of really good quality data, and we're able to say to a provider we will need X amount of advocacy hours in the area of Care Act advocacy, for instance, so then they'll be able to workforce plan a lot better. Also, I've worked on improving the relationship between changes in adult social care and advocacy. So, for instance, if we've got a drive on reviews within adult social care, that will have a knock-on impact to advocacy, and that early awareness of that to be able to plan forwards and that link. We've also built into the contract elements around reflective supervision and group reflective supervision, which will allow the advocates to be able to feel comfortable and secure in their role and their practice. So I very much think that this will improve a lot of the issues that have been raised throughout the engagement.
Great, thank you.
Councillor Milson.
Thank you, Chair. Thanks, Abby. Just a quick question about the, you've just mentioned, and it's mentioned in the report about flexibility to adapt to changing demand and legislation in the future, and you just mentioned the flexibility to work more in partnership with the ICB. In view of the item we've just heard and the conversation we've just had about joint working with the ICB, I just wondered what sort of headway you might have made already with that. Have you got some early relationships in place? Have you got any particular plans that you might be looking to develop with the ICB, and what response you've had?
Thank you. Definitely, I've reached out to, well, a number of different organisations in the ICB. First of all, what I wanted to do is map all the advocacy services that are happening in Sheffield at the moment to get a good clear understanding of what we commission as a council and what is commissioned elsewhere. And from that, I've reached out to the organisations that commission these with an open hand and saying really that if we're looking, we'll get better pickup, we'll get better value for money if we work together in the future. And I've already started discussions with a number of colleagues in the ICB about the potential of when their contracts end, looking at integrating and working together in the future.
Great, thank you, Abby, for this and for all the work that's gone into getting to this place. So the recommendations are approve the commission of advocacy services from an independent external provider for a period of 7 years and for an estimated annual value of 1.223 million as set out in this report, and notes that the Strategic Director of Adult Care and Wellbeing Services provide an annual update on impact of advocacy services to the committee. Members happy with that? Brilliant.
Chair, just a little point, I'm not sure if it comes in with this or in maybe a future session, but is it possible to have something that comes back that lets us know what the outcome of the commission is? The thing that I'm sort of concerned with is in the report it mentions, and it's not just for this item, the previous items as well, where it makes reference to the Race Equality Commission, and I'm really keen to see how many of the providers that are commissioned come from Black and ethnic minority backgrounds. So I want that to be something that we can look at in the future.
I'm glad you're asking that question because I ask that question all the time.
Yeah. So one of the key things we've built into the work plan for the committee is a regular update from the Assistant Director for Commissioning, and that particularly is about the outcome of the commissioning that we've undertaken, and particularly taking the learning from the Race Equality Commission, and you'll see about that later on in the Directorate Plan, is how we can show within the commissioning that we've undertaken that we have absolutely tried to take on board the recommendations from the Race Equality Commission as well. And that was one of the assurances that we want to build into the committee, was that very much as the commissioning update, so that members have that publicly and transparently fed back to committee today. And the first one of that actually today is actually the Homecare outcome, which is on committee today for noting. And so hopefully that provides assurances, but and that we are absolutely trying to make a focus on and demonstrating that forward. And one of the key things we've really done to committee today as well is also made sure that all the relevant reports have equalities impact assessments and climate impact assessments, which has contributed to some of the length. But that means then we're using these to absolutely inform what we're doing and going forward, so that absolutely members could be assured that we are delivering on these objectives, if that makes sense.
And in terms of this contract, I'll add that we're looking at the integration of volunteers and peers. So that will naturally happen, as well as a requirement for the provider to, just trying to think of the word, and the provider workforce to represent the community it supports. And how we measure that is something that we're looking to co-produce in the future.
Thank you. So we're happy to take the recommendation. Thank you very much. Thanks, Avi.
Thanks for your time.
And we are now on item 14, Adult Health and Social Care Financial Recovery Plan Update. So we have Jonathan and Liam presenting for us. Liam might be here for the next item, I don't know, if you're doing a double act on this one.
That's that one. Morning everyone, I'm Jonathan McKenna-Moore, I'm the Service Manager for Business Planning and Governance.
Morning everyone, Liam Duggan, Assistant Director for Care Governance and Financial Inclusion.
So the report is the second of our quarterly financial updates and analysis that we provide to committee as part of our financial assurance process. The first section just provides an update on the financial position for adult care and wellbeing. So we're currently forecasting a 3.5 million overspend by the end of the year. So that's been an improvement since the last update. I believe it's about 6 million movement over the last few months. The main reason for that is some one-off income that we weren't able to factor into the budget at the start of the year, but we've also seen some reductions in spend across several service areas, which has been contributing to the improved position. In terms of our recovery plan, we are looking at 16.4 million delivery of the total 18.9 million planned savings. And we are forecasting that the amount that is slipped this year can be fully recovered in next year's, as part of next year's budget. The page 4 of this report provides detail on how that breaks down. So you can see that across the different areas, and we've simplified that from previous reports. So a lot of the items that are completed or they're well in hand, we've now closed, and that's enabled us to focus on the key areas that are now in the table, which are the recovery reviews, etc. So the next section goes through those mitigations. I won't go through in detail, but it gives more detail in those section about the categories in the table. So it's for recovery reviews, the enablement pilot that's going on in future options, the staffing costs, changes in residential care, and the changes that we've had to implement due to Disabled Facilities Grant. Section 1.4 of the report refers to the Market Sustainability Improvement Fund. So that's some new funding that was announced in July, and it's 4.1 million this year and 2.3 million next year. So it's a total of 6.4 million that was announced in July by government. So it doesn't extend beyond next year. So we've had to sort of use it, prioritise some short-term investments rather than commit it to long-term spend. The full details of how we're proposing to spend that over the next 2 years is in the appendix, and committee are asked to approve those proposals as being consistent with our existing recovery plan and strategy that we brought to you previously. There's also just some detail there on the nature of the temporary grant funding and how that has led to an underlying budget pressure that we will address in the November report, which we'll come back to you with the 24-25 budget plan and also our recovery plan for mitigating the underlying pressure of 9.5 million that's detailed here, and that's currently being covered by some one-off income. But we do need to address it next year in order to recover that position. We've also provided a couple of other appendices. One, an analysis of some of our spending. We talk quite a lot about the impact of COVID. So there's part of the analysis shows you what spend was like pre-COVID for older people's home care and residential care, and you can see the impact that's made and how we've recovered since. And we've also talked to you before about the changes we've made to transitions. So we've done some analysis on the cost of services for people aged 18 to 24. So you can see how that has changed during that same period. That's it, unless we have any questions.
Any questions? Councillor Mills.
Thanks, Chair. It's more of a comment than a question, really, but I just feel really moved to say this because, I mean, I haven't been in this council terribly long, and I'm already you know, quite worn down with having to go through all these processes every year. So I want to say thank you for continuing just incredible hard work, and everybody on the committee and everybody in the team, because I mean we just look at page after page of this stuff and it's all penny pinching and scrimping and saving, and I just think authorities up and down the country must be utterly worn down and demoralised by this year after year, having to scrimp and save like this. So thank you for the work that you do, and really, you know, our primary objective is to deliver for people who need care and wellbeing services now in the future, and we can't plan for the future, and I think that's the biggest burden on us as an authority and many other authorities, and you know, particularly mindful of the situation in Birmingham. And so yeah, thank you for what you're doing, and you know, we back you up as a committee, and we're all working to the same objective, aren't we? Thank you.
Thank you, Councillor Wilson, and I'm sure everybody want to echo that. The officers do an incredible work, job, and they present every week at our committees. So we've had many conversations on most of these issues, but the financial kind of situation that all local authorities find themselves in is dire, because we can't look at long-term kind of funding. And although we're very pleased, because I don't think we've ever seen such a small, like 3.5 million in adult social care, projected overspend is not something that I've come across since I've been a councillor. But that is because we have some one-off funding. It's not because we can sustain that. So in the context of a very challenging environment long-term, we're doing exceptionally well, I think, at this point. So thank you very much for all your work. The recommendations are to note the update of the financial forecast for the delivery of savings in 23-24, note ongoing actions to mitigate pressures with specific regards to reviews and enablement, approve use of market improvement and sustainability funding grant, and request updates on the progress with implementation through our budget delivery reports to future committee, which I think is November, as you said. So members happy to take those recommendations. Thank you very much. Thank you, Jonathan and Liam. And we go swiftly into the last part of the meeting. The items from 15 to 20 are for noting, and Liam is presenting Q1 budget monitoring. Oh, sorry, Jane. Yeah, I've got it here. Sorry, Jane, I apologise. So Jane is presenting this, and this report has already gone to SNR, and it is the same report that goes to all committee, hence the fact that it is for noting. Thank you.
Thank you, Chair. I'm Jane Wilby, Head of Accounting. So the report that we've written today is to bring the committee up to date with the first quarter position of 23-24. The full report, as Chair kindly said, was presented to the Finance Committee on the 11th of September and to the Strategy and Resources Committee on the 7th of September. So at the Q1, the General Fund is forecasting an overspend position of 17.6 million against a net revenue budget of 487 million, which is a 3.6% overspend against net revenue budget. In 21-22, the Council identified a 70 million reserve that we were able to draw from to manage the risk associated with the delivery of our budget and budget savings. 2 years of budget deficits have meant that we've actually got 30 million left in that reserve. The fund was intended to assist with the delivery of budget improvement plans and stabilise the base budget. If we do spend another 17 this year, that leaves us just 13 for any further risks and going into next year. We need to make this year. So far, we're forecasting 37 million will be delivered, which is a 78% delivery rate, which is an improvement on the 22-23 rate of 65%. Included in the overspend, there are some one-off items. I think Jonathan talked about those in his paper, that mitigate that overall position. These amount to about 17.9 million in year, including some of the social care grant allocation for adults and children's, and continuing healthcare income in the adults committee budgets, but also some historic balances to level off some of the homelessness support grants issue that are having this year, and some allocations from specific reserves. The underlying trend of the overspend is probably more like 25 million, which includes all the increased demand for services and inflation pressures that we're feeling, and the increase in demand for homelessness services. So the three key drivers of overspend for the council are in adults, the 3.2 million overspend in committee budgets, which I'll discuss in a little bit further detail. Education, children and families, 8.9 million overspend in that committee, and that really relates to the high cost residential placements alongside proposals to increase foster carers in the service that are not being delivered due to current market conditions and demanding home to school transport costs. In housing, we've seen a really big issue this year in our homelessness support for temporary accommodation and supported exempt accommodation services, relating to increased demand for those services, shortage of suitable accommodation and an increased use of hotels for that temporary accommodation and unregistered providers, which is not wholly funded by DWP, and that's costing the council probably about 8.5 million in general fund budgets this year. So these areas are faced by local authorities nationally, and this has been reflected in first quarter positions of some of our core city comparators, and you quite rightly note the Birmingham position as well, and I think we're seeing a lot of 114 notices. It's a very difficult time for councils and similar issues across the board. In the adults portfolio, the majority of the overspend last year related to purchasing budgets, so overspending costs of care packages. We have included some one-off income this year, as Jonathan talked about, from social care grant funding. It's not been clear whether this is an ongoing funding stream, so we've kind of identified that as one-off income that has offset some of that overspend position, particularly in the learning disabilities budgets, which leaves the baseline purchasing budgets around about 0.7 million overspent after that allocation. So in the previous paper, it talked about recovery work that's underway to continue to drive the delivery of the budgets in this service, including establishing task and finish groups, developing business cases around investor saves, focusing on enablement day services, reviewing high cost support and maximising income where we can. So the recovery plan, which was presented, details how the service intends to address this in 5 key areas in the recovery reviews: enablement approach for working age adults, having a look at the staffing costs, residential care and the disability facilities grant. Just another point to note is the medium-term financial analysis was presented to the Strategy and Resources Committee on the 7th of September, which set out the Council's position for the next 4 years and identified a funding gap of 61 million, 18 of which will fall into 24-25. There were committee targets are noted in the paper for 24-25 for budget setting and the key assumptions around that. The report in Strategy and Resources requested that committees bring forward proposals to their November meetings, at the same time continuing to work hard to bring the in-year overspend down through ongoing work on the recovery plans and support the delivery of those BIPs in year. The adult social care target is set at 1.5 million savings for next year. So the real challenge will be continuing delivery of those budget savings from last year to maintain a stable baseline and continued focus work in the identified areas as discussed. So the paper is for the committee to note the financial position of the council at the first quarter of 23-24. I'm happy to take any questions. Thank you.
Councillor Ayres.
Yeah, quick question. I noticed on the previous report, and I welcome the benchmarking data against, which I think is it's useful for us to see as members, where we are in terms of the adult health and social care budget, that our portfolio budget is in line with other authorities. I'm just wondering whether the same sort of benchmarking information is available for the council corporately. I think that's the question really, because I do find it useful to see where we're at with our portfolio.
Absolutely. We do benchmark data across core cities and also local neighbours and sort of similar size authorities, etc. So we do have access to the, it generally comes from the government returns that we all submit. So there's we're able to draw on that data set and do some comparisons. Usually we're led into areas of most concern, so when we have got, you know, we do want to look across the board at specific areas, we do target that, and we can, you know, if there's any particular area that we want to look at, we can do that. There is the information available to do that. As I noted earlier on, we did look at the first quarter position of some of the core cities, and it was interesting to see that, you know, other areas are noting exactly the same issues that we have, particularly in children's social care, temporary accommodation support, and in adults. But I think actually our position in the adults service is actually, we've seen a big improvement. I think the committee's obviously noted that. So it is, you know, it's good to see that across the board, but we can share further information if the committee would be interested.
Yeah, that's useful. It's encouraging to know that it is improving. Thank you. Thanks for that.
Any further questions? So, are the committee happy to note the the report as suggested in the recommendation? Sorry, I'm just trying. The committee is asked to note the update information and management actions provided by this report of the Q1 22-23 revenue budget outturn as described in this report. Brilliant. Thank you, Jane and Liam. And we are on to item 16, which is Homecare, Care and Wellbeing Service Contract and Discharge Provision. And we have Catherine.
Hi, good morning. I'm Catherine Bunting. I'm the Assistant Director for Adult Care and Wellbeing Commissioning and Partnership Service. So this report is brought to committee today for noting. The commissioning strategy for home care remains as was in the report that came in June 2022 for approval. But for clarity, it's here today to note that at current delivery, the contract award will begin with approximately 38,500 hours a week for home care delivery. Also to note that the extension of our current contracts with providers, which will support a well-managed transition and mobilisation into the new contract with an anticipated go-live date of 8th of April 2024, and that will also support continuity of care and delivery of our hospital discharge and urgent delivery plan, which came to committee in June 2023. Those reports are all in links in the report that's come this morning for background information. Happy to take any questions.
Any questions? Are we happy to accept the recommendations, which is the committee notes the award of contracts for the care and wellbeing services, home care to delivery of approximately 38,500 hours per week at a cost of 42 million per annum, pending any 24-25 fee uplift. Notes the activation of the 6 months extension period provided within the current short-term home care call-off contract, thereby extended an existing contract from the 7th of January 2024 to the 6th of July 2024 to support planned transition and continuity of care, and notes the context and development of home care capacity planning to support hospital discharge. Thank you. Thank you, Catherine. Item 17 is transitions of young people to adult services. We have Tony and Andrew.
Good morning, everybody. Before I start, can I just thank you for your kind comments about the budgets and the pressure on staff and teams. It's nice to hear, so thank you very much for that. The reason we're here today is to talk about the report that we put forward to yourselves, and this is a report on an update on the transition service that came into play June 22, which we changed a few months ago, where we've added in the PAT team, which were the children's transitional team, into adults. So there's a more of a rounded support from the age of 14, 16 upwards, and a better relationship with adult social care. Tony's the service manager over transitions. I'd like Tony to go through this, if you don't mind, because he's done an incredible amount of work. The team are exceptionally well placed to deliver services. And I just wanted to bring a bit of human emotion into this. We recognise that the speed that this service has had to work through is vital, because any child that's 14, 15 or 16, we can't afford to wait years before we have the best quality provision in place. So the impact of this team on younger people has been exceptionally positive. We've had exceptionally good feedback, but the reality is that if we miss a year or so on a young person coming through transitions, that's essentially their end of their quality impact life, and that's up to us to make sure we don't allow that to fail. So thank you, Tony.
Morning, Tony Middleton. I'm the service manager for the Transitions Service. So in August we effected a workforce change that brought the adults and the children's teams together. Transitions has traditionally sat within children's services for the preparation for adulthood team, which did great work, but we still had that cliff edge that is well known throughout transitions. So the adult services were still kind of receiving people at 18 and effectively starting again. So during the SEND Accelerator Plan work, where we work very closely with children's services and senior managers, we started the discussions around merging the teams and where it was best sat, and this was completed in August. So the preparation for adulthood team is now part of the adults transitions team. What's different now is that we reach down into children's services. We become aware of people and become known to people from 14. We start to effectively work with them at 16, so that they're a genuine preparation for adult social care as well as adulthood. The aim is that we reduce that cliff edge to, at the very least, a manageable slope, because there is a change between the two. The advantage of having it all sat within adults is the information is current around what you receive from adult services. The workers know what is coming and can work with people and genuinely prepare them for that. We also provide enablement for everyone where it's appropriate coming through transitions, a genuine life skills piece of work that builds on what they may have been doing within schools or education or college, to better prepare them to maximise their independence in adulthood. The merger means the team consists of, there's around about 15 people in social work capacity, with 2 team managers, and they work with the OTs, but they also maintain those links with children's services. We have, I think the links between adults and children's in regards to transitions is as strong as it's ever been right now. We've worked very closely with them and keep those links, including attending team meetings on both sides, etc., so that we maintain an awareness of people. The visibility of the team is a lot higher. They're attending schools forums and parent care. We've worked with the parent carers in developing this model. And when we presented the proposed model in the Accelerator Plan feedback, the DfE noted it as an example of good practice that they would like to see rolled out elsewhere. We have also developed a respite service for people with more complex needs than we can currently provide for, particularly as people come through transitions. It's one-on-one, well, 3-on-1 work occasionally, depending on the need, but that's a service that hasn't been available within the city before, so that should come online in October, and that will help us keep more people within the city as they transition from children's to adults. The Adult Future Options Framework was launched in May 2023 and offers supported living activities outside the home and overnight short breaks, and that framework is for people who are 16 plus with a range of disabilities and health conditions. So as I said, this was developed through work with children's services and with parent care reformers and all of those and all those stakeholders that were involved in the Accelerator Plan. So we'll continue to keep those discussions live. And I think... Oh, sorry, yes. The outcomes we've had so far, so as I said, this was effected in August, but the teams were working very closely together before that, so we're effectively working as one team. We've managed to lower the waiting list, because there is still, we inherited a waiting list, but we've managed to lower that. The reviews are high, people are moving on into full adult social care a lot earlier than they have been before, and not just stuck in a treadmill of education or transitions team. Complaints appear to have reduced as we're seeing it, and as I say, the engagement with schools, etc., is a lot higher than it has been. Any questions?
Thank you, Tony. Thank you so much, and thank you to the team for all the hard work. I have Councillor Smith, Councillor Thornton, and Councillor Harris all wanting to speak, and Councillor Nelson.
Thank you so much. I can't tell you how welcoming this report is. Been on this committee for many, many, many years, and this has been a long time coming. And I do work with young people from 13 to 25 that have severe learning disabilities. And for their parents, we should be celebrating. This is amazing. So thank you for your hard work, and long may it continue. Thank you.
Thank you.
Councillor Thornton.
Just to echo that, really, I wanted to make a comment. I think your enthusiasm for this clearly resonates, and I think the enthusiasm for it as a project is echoed across the committee. Look forward to seeing the update in 6 months as to how this is, how this is continuing to work. But I think it's a good example of when something's not going right, not to keep going down the same path, but to find a new one. And I think that this is hopefully going to continue working well.
Thank you.
So thank you.
Thank you. I'm going to take those words back to our staff because it's vital that we hear this. And thank you in particular. We've spent quite a few years in the past with a few different issues, and it's a lot of the things that you've ever spoken about we are in control of now. Not totally where it needs to be, but that's the time factor. But thank you, appreciate it. Thank you.
Councillor Harris.
It's really welcome, the progress and our participation today. It really is a good news story, because it's something that I think that that those have been around a little bit longer, making people know that this is something we've struggled with for many, many years, and it really is gratifying to see this report, and thank you for your work. Thank you.
Thank you.
Thank you, and Councillor Nelson.
Thank you, Chair. Echoing what colleagues have said, there's so much passion and empathy coming through when you're speaking about the work that you're doing, and I think that's just so encouraging. That we've got human beings looking after human beings, and I think it's so crucial. Steering and encouraging and sometimes carrying young people through transition with. I mean, we as councillors, we hear cases all the time where people have fallen through a crack. And I personally know people who have fallen through cracks and struggle for the rest of their life. Exactly as you say, Andrew. One mistake or one missed opportunity can impact a whole life. I've got just two little weenie questions. So, the report mentions greater opportunities for collaboration between health, housing and care services. And I'm just curious how that partnership working is to be overseen, and from the person's point of view, from the service user's point of view, when there's that kind of multi-agency and partnership working, obviously really important for them to have a single point of contact. And is that, so where's the single point of access and accountability, as it were? So does the person in need have a person, one person? And then I've just got a question about the team that you've put in place. I don't know what those numbers mean in terms, is that adequate? Do you feel that that's sufficient, the team that's in place? Or do you have ambitions to grow it further? Do you think it needs to grow further? And what's the forecast looking like in terms of demand? So it's quite a, it's quite a negative thing to say after all the positive, but I think we all feel like there's quite a looming demand coming up. And children who were in difficulties post COVID lockdowns exacerbated a lot of difficulties for people. Is there a growing demand about to sort of come into that age group?
Thank you. I'll try my best to start with something that you've spoken about a moment or so ago when you thanked us. What we try to do in Adult Future Options, and with all the great difficulties that we have as a council and the services and the environment that we have today, is that we ensure that every time we have a meeting, we think about a person that we're working with, either now, next year, or the year after. What is it that we do today that's going to make the difference? And as long as we see people as people, and not sometimes as a tick box or as a touch of finance, but an actual person that could be one of our relatives or could be ourselves. If we continue to do that, then we'll stay on focus. So thank you. I'll try my best to answer the questions that you've had. I'll start with the first one about we are heading towards something called a named social worker or a named worker approach. And the essence of that is that when we start to work with somebody from the very first time through transitional approaches, or if they've come into adult social care later in life for whatever reason, we try to have one person that's going to stay or be that main contact point. Now, generally that's going to be social care because we are mostly involved people. But there are other elements here. There are day services where we've got some really, really good day services, as Councillor knows. We've got some exceptional good contacts there. We're looking at those places. We're looking at residential care homes and supported living as having a named worker that links in with our own service, our social care services. So any family member, a carer, or the individual themselves has a point of contact where they know who to contact and who knows about them and what they're. We're in the movement of going from a short-term crisis event approach, which is what we've been doing post-COVID, and we were in a better position, to a much more engaging approach where we've got short-term plans with people and then long-term plans. And the long-term plans also include our approach around older carers. So we're about to sort of a new forum for older carers who've got children who are adults with a learning disability or phys disability. So the contact points are very important. We have got several plans in action, and it does take time to get where we need to get with this, but so that's where we're trying to work. You spoke around accommodation and other points. We have just revamped the Learning Disability Partnership Board, which we've got more people with a learning disability on that board than ever before. We've got a co-chair with myself, who's co-chairing for the next 6 months or so, and we'll have to see how it goes. I'm more than happy not to co-chair, but I think the approach of having somebody with a learning disability is the right thing to do. And then we're taking that forward. That's given us opportunities to advocate and support people in the community as well. We're also on the accommodation group in South Yorkshire with the ICB, so we've got presence in accommodation. The point I was talking to Alexis about this morning is we've got a new opportunity around learning and lifelong learning, I should say, to see what we can do there going forward with employment opportunities. Two points very quickly. Enablement is a service that we're just starting to recruit to, which will work with our transition service and people with ongoing social care needs who've been in services for a long time. And we can work more in depth with those people to get the better outcomes, either short term or longer term. That includes a couple of OTs, so some OTs working with and providing direction of that outcome. If we work with those people with accommodation, community asset building at the same time, and employment, we will take some pressure off the finances within the ongoing care group, and therefore being able to focus more time on the concentrated complexity. There is a pressure on people coming forward. Last year was the biggest pressure we had with younger adults coming through. We had 140 people come through last year. Some of that was to do with the APP approach, where our transition service is now in place. It's going to take us a longer time to bring them through over the years. We actually pulled them through in 1 year, so which is exceptionally positive. That's remained high though, so there's more children coming through with autism and ADHD, which we're aware of, and we're looking at how we can impact on the budget in different ways as we speak. So thank you.
Can I just also come back to the collaborations with health colleagues, etc., and housing. I mean, this is all early stages, but I think what it mostly relates to is those links, and collaboration is as strong as it's ever been, and we are developing as we go along, and that's where those opportunities will come from. We see ourselves as a very outward-looking service to be able to move people to where they need to be.
Brilliant. Thank you so much. So, colleagues, the recommendations are to note the improvements made in relation to supporting young people to transition to adult care, and request that the Strategic Director for Adult Care and Wellbeing provides an update to committee every 6 months as to progress through the strategy delivery updates to the committee. But also, I think we sort of discussed maybe putting together like an annual report to celebrate the things that go well, but also look at the challenges and how it's improved over time. I think that would be a really good thing to, to have. So, members happy with those recommendations? Thank you. Thanks, Tony and Andrew. And I have item 18, which is Adult Safeguarding Delivery Plan, and it's an update. And I believe that Dawn is presenting with Janet. Thank you.
Hello, thank you. Yeah, Dawn Bassender, Chief Social Work Officer. Janet Kerr, Operations Director. This is all Dawn's work, but we're in a sort of handover phase, so that's why I'm sitting up here joining her. Thank you. So the ask of the committee today is to endorse the progress made with implementing the Safeguarding Delivery Plan. Also to endorse a consultation programme regarding safeguarding responsibilities, that's Appendix 2, to enable us to finalise that and then bring it back for approval at committee in November of this year. And that updates to the progress against the delivery plan are continued to be brought to you every 6 months. So Appendix 1 details all of the progress that has been made over the last 12 months, and it's also got the future plan there. And the report highlights how we've now got the dedicated Adult Safeguarding Board Manager in post, which is brilliant. We've also got in post the Safeguarding Coordinator and the Social Work Consultant within the MASH that was mentioned in previous actions. We've made really good progress and have started implementing the regular safeguarding audits. They started in August, as we said we would. We're looking at recruitment to a dedicated safeguarding insurance lead to further progress in this area. The performance update is found in full in Appendix 3, but the report highlights certain elements, such as we've listened to partners' requests to improve the feedback where concerns didn't progress to inquiries, because we've always done well in feedback where they did progress to inquiries. So we've improved that by 13%, and that's now up to 87%, so we've done really well there. The report also highlights the launch of the MASH has been really successful and they've done that successfully while also managing significantly more referrals, 52% more. And I go to different meetings and I'm getting praise coming quite randomly about the MASH, how the huddles have really improved the connectivity across the partnerships, and that in doing so improves the quality of the safeguarding for the people of Sheffield. So that's really good. We've made some changes to Liquid Logic, which is our recording system, so we can now capture organisational information and organisational safeguarding information in one place, which is a big step forward, and that's really good. We've undertaken a thematic review and the action plan had been agreed, and the next steps that are underway is a council-wide safeguarding review as well, which is making a good start, and we're looking forward to getting those the information back and developing an action plan from that. We have updated the safeguarding policies and procedures, which is something that's been needed to be done for quite some time, so that is done.
And what we've done in that is included practice guidance in line with the what good looks like ADAS guidance. So making sure that we're in line with that guidance there. So Appendix 2 is the one that I mentioned, that's the draft Safeguarding Responsibilities document, and that's what we would like to go out to consult with partners regarding the use of this to support them in their decision making as to when to alert the local authority to concerns. And as I said, Appendix 1 has got the forward plan in that as well. One of the key steps there is to continue reviewing how we record safeguarding in liquid logic, so we're really capturing and able to celebrate all the good work of the staff. Any questions?
Brilliant. Thank you first of all for your work. And yeah, I attend the Adult Safeguarding Board, and all the conversations that I've been kind of part of in terms of better communication and having all the information in one place so that things don't get lost in translation. It's incredible how you do, by doing the right thing, you make it more efficient, better for people, but also it's more efficient financially, which is, a bonus, because we want the really good outcomes for people, but obviously in the constraints of, ever depleting resources. So thank you so much for, taking this bull by the horn and going for it. Are there any questions from other members? So are we happy to take the recommendation, which is to endorse the progress made with implementing the Adult Care and Wellbeing Safeguard and Delivery Plan, endorse a consultation programme during September and October on safeguarding responsibilities noted at Appendix 2 to enable final approval of committee in November 23, and request that the Strategic Director of Adult Care and Wellbeing continues to provide the committee with updates on progress against the delivery plan on a 6-monthly basis, including updates made based on ongoing learning. And Fiona, you're making a note of when we need to have these updates in our kind of work program, aren't you? Thank you. So item 19, thank you Dawn and Janet. It's Adult Care Strategy Delivery and Service Performance Update, and I think it's Alexis who's doing this one.
So thank you very much, Chair. So I'm here to present the Strategy Delivery and Performance Update, and this also counts as my DAS update to try and streamline reports today, given that we have quite a lot of cross-cutting items on the agenda today. And first of all, I'm going to start with a big thank you actually to my team, and to also all to my colleagues that work in the VCF and of course with providers, because what you've heard today is a lot of really good, projects and developments that we've taken forward over the last couple of years since the strategy was approved at the Global Executive. And what that really highlights is just how much, all the different pieces of work that have been undertaken that ultimately is leading to a situation in which we're improving outcomes for people. We are starting to improve our performance across the piece. But equally, what we're doing within it is also creating financial resilience in adult care as well. And we are very much, taking these big 3 things forward together. And, one of the key things for me in all of this has been about is how do we become a point where we are bold, brave and ambitious for the people of Sheffield. We want to not just do what the regulators say that is absolutely the minimum we want to go and do. What we want to go and do is actually say, for the people of Sheffield, let's ensure that we are delivering the very best outcomes, because that's what people deserve. And what the strategy delivery plan and the performance updates, it shows our progress upon doing that. But equally, what it does show is where we need to target and focus as we go into 24 and 25. And I'll come on to some of that in the directorate plan next. And, and particularly it really helps to kind of evidence, particularly we need to have that continued focus on people with a learning disability, people who are autistic people, and equally people experiencing mental health, because we know that is the areas in which we need to make sure that people's voices are absolutely heard and supported and going forward, and we want to go and do that. And, one of the key things underneath all of this has been our continued focus on collaboration. And for me, what's really came out quite a lot today in the presentations today is our collaboration with colleagues across health, with children's services, with housing, with colleagues in the VCF and equally with colleagues across the sector. And for me, that collaboration, what that really helps us to go and do is very much set the scene and the foundations for much how we could absolutely, continue to go and improve as a service together, and fundamentally deliver upon our strategy, which is living the life that you want to live. And that really is what we want to go and do. So I'm going to stop there and then open for questions.
Are there any questions? Councillor Nelson.
Thank you, Chair. Thanks, Alexis. Just very quick, really. There's a couple of things. Just thinking back to the Festival of Involvement, and we've talked about this before, and we've had conversations around what happened at some of the sessions and people coming in more to bring grievances than to actually engage with the conversation that was intended around involvement and how to improve involvement. And I just wonder what your take on that is, in terms of this sort of performance update. Where do you feel that festival got us to? Is there still more work to be done? Did it complete any of the objectives that you wanted out of that? And also just referring to a priority that I think we've all shared, which is to support unpaid carers. And there are mentions here of support to unpaid carers, carers delivery plan to improve lives and outcomes for unpaid carers, joined up offer for all carers through the carer centre. Could you just add a little bit of flesh to the bones on that? What kinds of things are available to unpaid carers? How easy is it for them to get into the system? There's a reference to increased referrals to the carer centre. How's that going? Is there still more work to be done?
So I'll answer the first question first. In terms of festival involvement, that for me was our first step at really developing, to co-designing how do we co-design and going forward, and so that we weren't starting from a position of officers know best. We started from the position of actually let's co-design with people. How do we embed involvement right across what we do? And that to me is absolutely core in how we go forward. So we really listen to people. And the festival involvement, what that really stood out was two or three key things for me, and that's really highlighted within the directorate plan, which I'm going to come on to next, is that first of all, we need to make a key priority around citizen leadership and really promoting that people's voices are absolutely core to what we do and embedded across everything in adult care and how we go forward. And the first thing that's done is helped us to kind of develop a framework and for how we do that in a meaningful way and going forward. And part of that's been about developing a co-chair role within the Learning Disabilities Partnership, but also within the Autism Partnership, which is what I chair as well. And we want to go further with that kind of approach. The second thing that we developed is how do we work in a different way to enable people to speak up about the concerns that they've got, and so that people could feel, right across from safeguarding issues, right across to where people are experiencing challenge. So one of the key things I'm actually doing is tomorrow to meet with the voluntary sector, is to look at how we work with the voluntary sector in a very different way, so the voluntary sector can very much take upon that role and work with us in a very much an independent and a co-produced way, kind of building upon the work for advocacy, which you kind of heard earlier on today, so that people's voices are able to be taught, really brought through in a very, very different way we've done it kind of normally. And the third thing that it's really done is helped us to think about how do we ensure that we focus on citizen leadership. And one thing we have to talk about is involvement. And I want us to take us to the next stage and say how our citizens, how our leaders for the future, people's experiences are absolutely, people are absolutely perhaps employed by the council. I would love us to get to the point where we've got people with a learning disability employed, people with who are become citizen leaders, as opposed just to being focused on involvement. So that is one of the key things that really came from us. And I think that one of the key things for me is about how we really be ambitious and we go beyond what has always been done before, and we just be really creative and go for it. And I think we can do in Sheffield because we've got a lot of good people here who are really up for that challenge and want to go there. And often one of the things I think I've got as a director role is to in some ways is to inspire that across people and to really inspire that ability to go off and to go and do that. And that is one of the privileges that comes with this role, I think. And then secondly, in terms of carers, is one of the things over the last couple of years as we've done is we've actually did three key things. Is number one, we've developed the contract with the care centre to develop a holistic care support service, very much focused on outcomes for carers, which is really important. But we've also, in the last year, has also transferred the support for carers who are supporting people experiencing mental health also to the carer centre as well, so that people who are perhaps are looking after somebody who's an older adult, as well as perhaps a family member who's experiencing mental health, are not having to go to 2 or 3 different services. They can go and speak to the one person. So we want to have a far more joined up holistic offer, and that's one of the key things that's been implemented as from this year. And then the third thing for me has also been about how do we make it easier for people who are particularly going through hospital admission. You know, and that could be sometimes some of the most challenging periods in a person's life as a hospital admission, and how we make that a lot easier. So one of our performance measures has become about is actually how many people we're referring now from our hospital discharge services to the carer centre to me as a measure. So I'd want to see that, you know, as a baseline for where we were last year, continue to increase and increase and increase, so as we continue to identify and support unpaid carers. And equally, you know, as we have developed more awareness, what we're aiming to go and do is in October, but also later on in the year, is start to really very much focus on the bigger, wider campaigns to raise it more understanding and identification of unpaid carers, and do that very much as a partnership with the carer centre. And then the final bit for me is also about working with partners across the city, because one of the ambitions I have is that we really want local area committees, you know, and communities to really understand the needs of carers. So we want to kind of go bold there, but equally thinking about the GPs. You know, many people will go to a GP surgery, you know, with their family member, and for me, that collaboration that we develop in my primary care is where we'd want to see primary care colleagues also being able to kind of, you know, identify and recognise, and so that if we think about it from the point of view of a carer's journey, you know, not only we joined up and we made it often more connected now, you know, as we go forward, we want to continue to build upon that, so that if you're a person who's looking after another person, you're seen as valuable yourself, you're seen as valued, you're seen as supported, and ultimately you're seen as safe and well, and you get the support that you need in your own right. And that really is the crux of this. And as we come on to the directorate plan, you'll see that that's one of the key priorities that we've made in going forward. So that's that.
Councillor Thornton.
Chair, it was just a quick comment on a thing that you touched on about employing people with learning disability, and I know that's something that actually in particular that Councillor Smith's very passionate about, in terms of, you know, not just involving people in meetings that they voluntarily give their time up to, but paying people real wages and getting them involved in every stage of it. I went to a conference many years ago now about employing people with learning disabilities and getting into employment. And the example that was given was that of a pharmaceutical company that had brought in a supported employment place. And they actually found 3 things as a result of it, which was, first off, that their staff morale just went up because they found the giving back part of it, of involving them in the team, really helped them feel better. Secondly, the staff across the board all increased output and became better at their jobs because they were having to explain it in more simple terms. And thirdly, that there was a financial benefit across the board because they had to simplify their processes and they cut a lot of unnecessary chaff. I think that is something that I just, as an example, like, I think it's really, really valuable, and I'm glad that that's something that you're passionate about as well. As I say, I know that Gail is as well in particular. But yeah, I'm really pleased to hear you mention that.
Thank you very much for that, and it's really great. And I'm going to say it's a big thank you to members as well for the support you give to adults, because I think that really supports us to go off and do what, you know, exactly that, to be, you know, to go and take us to that next stage, and that support is really absolutely invaluable. And, you know, particularly, you know, I think about people with learning disability and autistic people and people experiencing mental health. Is, you know, it's you know, for me, it's what we really want to do is make sure that people who particularly are seldom heard could be heard, and could be citizen leaders, and could be absolutely, you know, be employed by the council. And I want us to be really innovative in how we do that. And I know Andrew, who's there, has got lots of ideas on how we want to take that forward. And but equally, you know, I think it's really important that we also think about, you know, older adults and people living with dementia. Earlier on this year, we hosted a conference that was organised by people with dementia and for people with dementia, and we were the spectators as professionals, and I think that to me was really fantastic. And I think one of the things that really, you know, for me, that from that particular conference was how do we also recognise that unconscious bias of people, you know, that we sometimes have, and as to think about how we, you know, very much put citizens' voices at the core of what we do and help us to move forward.
Councillor Smith and then Councillor Mohammed, and then I'm going to draw.
Thank you for that, and very welcome. I'd just like to say that we ought to look at ourselves and say, where in this council do we employ young people with learning disabilities? And that is something I have been shouting about for the last 20 years, to be honest. We need to lead by example and learn from it and pass on our learning that we've learned from this experience, because it is an amazing experience working with young people with learning disabilities. And I just want to add that a lot of young people with learning disabilities, when they get to adult life, suffer from mental health, and it's mainly because we don't give them the help they need in employment. And sorry, gets me a bit emotional. There's a hell of a lot more that we could do, but we need to lead by example. Thank you.
Councillor Mohammed.
Thank you, Chair. So it's just to echo previous points that have been made in terms of the level of sort of development that I've seen as a member of this committee now for the last 2 years, and I can see the trajectory is completely in a different direction, and the partnership work that's taking place. And it's really welcome seeing these detailed reports in terms of how you're meeting KPIs. I think I've just got one point that I'd just like clarification on. So on your sheet, just looking at page numbers, I can just minimise. Hang on a sec. There isn't a page number. Where's the page number? Put page 439. So where you give examples of things going up and down and increased against other cities, and then further up you talk about developments for ongoing years. So the next 2 years, this is what we intend to do. Just using carers as an example, this is a point that Ruth brought up. In terms of direct payments, we know that we're quite low compared to other cities for carers, and yet that's a green on this sheet. So given that we see it as a positive because we've increased compared to previous years, but actually if you look at the regional and national picture, we're not doing fairly well. Should things like that be an amber rather than a green, that we've still got work to do? And I couldn't see what we were doing in terms of how we were going to work with carers going forward to actually increase direct payments in the 2-year forward plan, like this is what we're going to do for the next 2 years. But I found it really, really helpful seeing that sort of for the first time and having that in front of me.
It's a very good point around the direct payments. It's one of the differences that Sheffield's got from some other areas is that we have, you know, commissioned a carer centre. So in some ways, one of the challenges behind some of these figures is apples and pears. So other areas don't have a carer centre that they commission to do the work. So one of the key bits of work that we're doing behind us is trying to understand what does the data really mean. So for instance, one of the key things in going forward from the next year as part of the Direct Payments Improvement Programme is to look at how do we work with the carer centre so that we can improve our focus around direct payments for carers as well through the carer centre. So that's going to be part of some of these works will kind of come together. And I think as we started to put our data into priorities, what that's really kind of helped us to go and do is not only get underneath the data, but also think about how do we, in a sense, be more ambitious than what we've been in the past. And I think for me, it's one of the things that we did is a lot of the milestones in there are like old milestones. And what I wanted to do is, as we go into the next phase of our directorate plan for 24-26, is be more ambitious. But I want to set these targets with members, You know, so in some ways, these are milestones that have been around historically. As we go into formalise, and the directorate plan is the next stage of this, is really working with members to say, let's be really ambitious, let's set out our stall as to where we want to be in Sheffield. And for me, I think I'm really keen that members are really, you know, absolutely, you know, are owning that milestones, if that makes sense, so that it really means as officers, we're absolutely then working to the milestones that's been set by members. So I think it's a really astute question. I'm really glad you asked it, because that's where we want to get to. And I think that one of the things that I think undergoing the data has really got us to think about is one of the things that's been quite interesting with the data is when you compare some of the national outcomes that we have to with our local data collection, with our I statements, some of it marries up, some of it doesn't quite marry up. So one of the pieces of work that we're doing now as officers is basically then is using that framework to say how can we make sure that not only we've got accurate information, but also what we're doing is using that to prioritise and focus. And that's it. So yeah. So it's a foundation for the future, and it's, you know, I always have this mindset, it's that you're better to know yourself than not know yourself, the good or the bad. So it's good to go forward and to recognise the good and celebrate successes, but it's also good to also know, in particular in areas that are red or amber, that we need to focus on and prioritise for going forward. So thank you.
Thank you. Drawing it to close with the recommendations, endorse progress in delivering upon the adult care strategy, living the life you want to live, and notes realignment of the adult care change program around outcomes in the strategy, notes the performance update and areas for prioritization in 23-25, requests that the strategic director of adult care and Wellbeing continues to bring a 6-monthly update to committee on our performance and delivery upon the strategy. And finally, the last item on the agenda is item 20, which is Alexis again, and it's the Adult Health and Social Care Strategy Refresh and Directorate Plan.
Okay. So one of the commitments that we made when we developed the strategy, Living the Life You Want to Live, in 21-22, was it would have a biannual update within that, so that we maintained it being refreshed, because it's a 10-year strategy and things change, a lot of things change sometimes after a short period of time. So we want to make sure it was current, and the priorities were continued to remain current and focused on what we need to go and do. So basically in June committee we gained approval to go and start to develop a refresh of the strategy and directorate plan, based on a few different things: the learning from the festival involvement, the learning from our performance, you know, and what that's telling us we need to focus on for the future. Equally, the learning from the Race Equality Commission and the corporate peer review, and some of the learning that's been around the wider council, as well as learning that's been around adult care as well. And equally, engagement with members. So we had members, you know, session, and equally interaction with colleagues and stakeholders across the city. So what we've done based on that is pulled that together around the priorities that were identified for with members around each of the outcomes in our strategy. And that is highlighted in the very draft plan today, with the milestones within that. And one of the key next steps we'll do is then, because we've always tried to take a very, very open and transparent approach in adult care, is to go back out for a period of consultation and engagement with individuals, with carers, with VCF and with fee sectors, and particularly with social care providers and with members, so that we make sure that we've done 3 things. Number 1, we've picked up what people told us, right, in terms of priorities, checking it out. And then secondly, checking out, have we missed anything as in terms of a priority? You know, have we missed anything? And then third, you know, for me, which is the key thing, is how will we work with colleagues and partners to deliver upon these milestones, and partners, building upon that collaboration that we've really developed in the last couple of years. And that then will be aimed to then have a final strategy refresh and directorate plan for December committee, which will then take us into 24-25. And the performance dashboard that has been seen in the previous report will then go alongside that, so that very much as Councillor Absalom Mohamed's point earlier on, is what we should be able to see then is the impact of the strategy and the priorities has upon the milestones and the outcomes for people, very much alongside each other. So that programme realignment, that mapping has been done to bring these all together and to get us into a very much simplified straightforward place. And equally, the strategy updates and the updates we give to committee, very much part of that and going forward, so that members gain an assurance, but also you can see very much the progress that we're making and very much in adult care. So that's the directorate plan. It's another step forward, and it's another way to very much continue to remain current, focused and continually improving.
Thank you. And what I find very kind of reassuring is the fact that by having very precise kind of documents, it's also we can track progress, and we can also always go back to that baseline where we start and where we are and what we're doing right, but also what we're not doing so right, and owning it, which is really important. And I think that's the kind of attitude that I find the whole team has, is that owning the progress and the process in a way. So are there any questions or comments? Okay, so the recommendations are: endorse the draft adult care strategy refresh and director of plan 23-25, approve and supports an engagement program on the draft director plan throughout October and November 23, and agrees the final director plan will be brought to committee in December 2023 for approval. Brilliant. Thank you. Thank you to everybody. It is 12:06. I'd planned to finish at 12:22. 20 items on the agenda. You've not broken me yet. So thank you very much. And can I just say, I want to say a huge thank you to colleagues, members who have attended weekly briefings on a Wednesday morning, including not just me, Councillor Thornton and Councillor Milson, but other members, and they've been really helpful. With lots of work has gone into these reports, you know, on a weekly basis, and officers have been very patient with us and gone back and rewritten, and that's why it feels like we all agree on everything, is because we do all the homework before the committee. So thank you for reading so many reports, everybody. And our next committee date is on the 8th of November, 10 a.m, I believe, and we will see you there. Thank you.
Okay. Thank you. Thank you.